Hello, and thank you for joining me with Real Boys Talk. This is our health series. My name is Amber Moore, and I'll be your host today. Today, we're going to talk about studs and STD. We're going to use a little bit of medical research that I kind of did on some things, and then we're also going to talk just about just being very transparent and very open, and hopefully giving you guys some resources, some thoughts, all of that kind of stuff. We're going to do a little bit of everything on this one because right now, STDs among masculine presenting is the numbers are rising, guys. They're really rising. And I think a lot of that is because we're out here. We're just out. We've been closed up. And I don't want to blame the pandemic or give an excuse of why this is happening, because I've learned that this is happening a lot of places. This is not, and I shouldn't say a lot of places. It's happening in a lot of demographics. Okay. Black women, period. Overall, whether you're a lesbian, masculine presenting, or a straight woman, are having, or bisexual or what have you, are having high numbers right now. Okay. And I'm going to tell you about us. And I know a lot of you all are going to sit and go, God, that's true. That's why I don't go, or that's why I don't do this, or that's why I'm not doing that, or I did not know. So hopefully we're going to clear up some myths. Hopefully we're going to give you clear up some misconceptions, some misinformation. Hopefully we're going to give you some good, positive information. And as you always know, every time I do something when it comes to our podcast, what's my statement? It's not just that you heard what I said or you liked or didn't like what I said. Take this offline, have a conversation with your friends. All right. Keep the conversation going and growing. That is the whole point of what I do and why we have Real Boys Talk podcast. Okay. And then I got some announcements at the end, so you're going to want to stay in. All right. So let's talk about this. Masculine presenting and STDs. First of all, we must understand that right now we are impacting the number. We're impacting it on levels of the reports that are coming out, CDC reports, some other organizations that are doing these studies and are doing different surveys are finding out that we are very immature with our sexual behavior. And what do I mean by that? I mean, we are not protecting us or our partners. And yes, I put an S on that word partners because a lot of us have more than one and we're not protecting them. And also, I don't know if people are falling into this thing that we cannot be monogamous anymore. That I don't think that that's all true. I think a lot of times we want to have cake, pie, a scoop of ice cream, and some muffins or brownies. We want all of it. We want everything. And I don't think that we're not dating properly. We're not building healthy relationships. So as you can see, all of this is going to tie together, right? So let me give you some information. So it looks like that drawing from existing literature, community studies, health reports that I just mentioned, this research highlights the unique challenge faced by this demographic, masculine presenting, in accessing healthcare, in engaging in preventive behavior, and navigating social stigmas. This is coming from a public health paper that I actually got, and it's several different entities that filed into this one paper that I'm referring from. And I will be putting this particular paper up online on realboystalk.org website, probably 1 week after we have actually aired this, which will air this Friday. It will go it'll go again on our website, as you know, and then also this particular document will be up there as well. All right. So it looks like what's happening is that there are challenges for us, which we all understand. The number one challenge is healthcare. We don't go. So we don't get tested. And they said, and that's one of the things they said, is that the one critical health issue affecting this community is STDs. That is where we are right now. It's outperforming, and I hate to say it like that, but it's outperforming breast cancer, cervical cancer, which is, as you all know, is what the grounds that Real Boys is actually built off of was the surveys that we did when we first were in program under the health initiative in Atlanta, Georgia. We did a national focus group to find out about cervical cancer, breast cancer. Now, guess what? I have to now add what? STDs to my programming. And because I didn't think I had to talk about it, but we do. All right. So we're looking at the effects. And what is happening is that as they created this paper and did these studies and looked around for different information, we don't have a lot of numbers. We don't have a lot of research done on the masculine presenting. Now, Black lesbians, we do. And why do I say it like that? Because Black lesbians, they clump us all together. Okay, they put your masculine presenting along with your femmes, and they don't separate when it comes to research. So they go, hey, it's African American, lesbians or Black lesbians. That's what it is. Not realizing that there are some things that we need to have geared or targeted towards us as masculine presenting. All right. And let's talk about health, identity, and healthcare access. I think that's a major thing because, as we all know, as we have all encountered at least once it should be every year or every 5 years, but I'm not going to get on the soapbox too much. But what ends up happening is that we have experienced from my own knowledge, my research that I've done through building Real Boys Talk as a nonprofit, and the programming that we had done in the research that we did, along with this now up-to-date research, is finding out that we often experience discrimination, bias within the healthcare system, which is a deterrent for us to seek care. Absolutely. Absolutely. That is so true. And that, honestly, they didn't really need no study. I think we all know that. All right. So the thing that we're coming up against is that health providers lack in cultural competency. They lack in leading. They lead with misunderstandings and discomfort during a medical visit. Let me give you an example of what I mean by that. My own personal examples. I went to a GYN when I was working for the health initiative with Real Boys Talk to test out some of the different GYNs in the Atlanta area. I went to a gentleman, signed in, everything, got there, the nurse walked out, called my name, was looking at somebody else because, of course, look, I'm masculine presenting, and I guess she thought I was here with somebody that was back in the back. So when she called my name, I got up. She looked strange, but she caught herself, walked through the door. She put me in the examination room, said, "Doctor will be here in a minute." I said, "Okay." So doctor walks in, never once did he look up. He had the notepad in front of him, the clipboard in front of him, and he started asking questions. He said, "Oh, Miss Moore?" And I said, "Yes." And he said, "Okay, so I see you're here for, your, annual, pap smear exam." I said, "Yes." And so he says, so he says, are you, what do you say? Are you are you protecting yourself during sex? And I went, "What do you mean?" And he was like, "Well, are you using condoms with your husband or your boyfriend?" And I was like, "I'm sorry, but I'm a lesbian." That is when that man looked up and then looked at me and did not know what to say next. He stood there for a minute looking stupid and then was like, "Oh, okay, give me one moment." And the next person who came in was I guess you call her like the higher nurse is like the practitioner or the assistant. She was like, "Oh, I'm here to help you." And I was like, "Well, what happened to the doctor?" So those are things that we all go through. All right. We're always looked at strangely because we're masculine presenting. So they go, they'll say sir. And I'm like, "I'm not a sir. Why would I be a GYN and I'm a sir?" Right. Or as some of our transgender men have to still go to get, make sure they have because even though they have their breasts removed, they still have to go to make sure that they do not get breast cancer. And if they still have their female organs and have not had their bottom surgery, they too also still have to go get. That is the only time. And so that is when we have those issues. And I'm not excluding them from this conversation, but we are focused on our masculine presenting when it comes to STDs. So that's the first thing, is that we don't go and access healthcare because of the discrimination that we all encounter. It is not a get to know me. First and foremost, you are looking at my You're looking at my, my coochie, right? You're looking at the vagina. Yes, I'm gonna go ahead and use the research on, proper verbiage for it. You're looking at my vagina and you've yet to even look in my face. That bothers me because we don't have a relationship. I need to have a very good relationship with the person that is going to be looking all down into my stuff. You know what I'm saying? You digging all in my stuff. You don't know what I look like. You have not even looked me in the face and shook my hand and said, hello, how you doing? How you feel today? You just in there doing what you do. That is one of the reasons why I believe we don't go as much. And I will tell you, those of us who have partners, feminine partners, because they go, they make sure we go. And that's something that I have to say bravo to my films, because thank you for encouraging the positive health and making sure that your partner is healthy by making them go get their annual pap smear. I know it is not pleasant. I do not like, the worst thing I hate about going is the fact that they keep saying, can you come scoot down a little bit more, scoot down a little bit more. First of all, ma'am, my legs are in this thing and they wide. I know my feminine ladies, my femmes, I know y'all, we assume that y'all do not have anxiety. And I'm gonna be real with y'all. I know I used to. I don't anymore because I know now. I know better, right? When you got information, you do better, right? Know better, do better. So now I know it's not like that. I know that now I realize that my femmes do have just as much anxiety about going to have a pap smear as we do. And sometimes their anxieties might be even higher than ours, but we do have it, right? We are very uncomfortable with that scoot down just a little bit more, scoot down. I hate, I've been wanting to say, ma'am, and then I don't like the fact, we won't get into all of it. I'm sorry, I'm digressing. So let's get back. So yes, we have issues with our visit. So we don't go as often, which means we don't get tested as often, which is a bad thing. And I think that a lot of times we go to we get with new people and we don't go get tested because it's like, what the hell I'm gonna do that for? And I'm gonna say this, a lot of times it's because you changing up partners, like you change your draws. That is not healthy because you don't know what you're getting. You need to take breaks. You need to make sure that you're healthy after every relationship. Even during the relationship, you should be doing that, right? So now that we've figured out what this is, what is the main number one reason why we don't get tested for any of these things, it is because of the fact that there's a lack of misunderstanding. And that's on our part as well as on the physician's part. And then there's that discomfort. It is anxiety, serious anxiety when you have to go to GYN, right? So now what they did find out is that research indicates that STD is widespread among African American communities. We ain't talking just about us. We talking about the African American community. Black folks, what is we doing? It's with higher rates of infection such as HIV, chlamydia, gonorrhea, compared to any other racial group. What is we do? What? Hello? What is going on? Like I'm all about a good time. I'm all for that. But guess what? I need to be able to live to see tomorrow. I need not to be walking around with some stuff I can't get rid of or stuff that literally changes my entire life. Right? We don't need that. The data says that on African American masculine presenting gay females is out of control. All right. And then the fact of being able to actually get research to get numbers is even harder. And why? For the beginning reason, we do not access our health care. We don't go. So we don't get tested. So we walking around here with shit. We walking around here with the STDs, the HIV, all of that. And I'm gonna tell you, Atlanta is high with the HIV with Black females, not just masculine presenting. Not just my Black lesbians, but my Black gay, my Black straight women. It's high. In Atlanta, Georgia, it is high. Fulton County Health Department did a research several years ago, actually, before pandemic, and it was really super high. It was like in the 60, 65%. It is ridiculous that is what's going on. So we have a social stigma that also plays a significant role within the sexual health of the African American masculine presenting gay female. This stigma is associated with with both our sexual orientation and our gender representation or presentation, more or less. And it leads to a risky sexual behavior. Let me explain. And I've said this in different panels and different conversations, is that a lot of times, or recently, or in the, I guess you could say, in times, masculine presenting gay females are perpetuating the traits of Black men that Black women are complaining about. I don't know if y'all heard me. I'm gonna say it one more time. A lot of times, we as masculine presenting Black females are imitating the traits that Black straight women are complaining that Black men do. We pick them up. Let me give you an example. That having your pants below your butt, showing your drawers, grabbing your couch. You don't have one. You do not have a penis. Stop grabbing. There's nothing there. We still have to understand that we have a female body. Unless you choose to change that body, which you have every right to do, whether you are transgender or not. A lot of people are not transgender, but they just don't want the tatas, or they want a flat chest. They want, and there's nothing wrong with that. I feel like you have to, if you're going to walk in your truth, make sure you are comfortable as you walk in your truth, right? I prefer I am as masculine, and I love my masculinity. I teeter very close on that line of looking like a man. I do not want to be a man. I don't like to be referred to as a man. I am who I am, but I really do embrace the heavy level of my masculinity. So that is something that is also, and when they say sexual behaviors, it is also like this. We are not taking the time to build relationships. We out here fucking, folks. Let's just be honest, okay? Let's just be, hey, if you can't be honest today, you're not gonna be honest. You're gonna be hurting tomorrow. I'm just gonna bring it to you. Excuse me. So what's happening is that we're doing risky sexual behavior. I'm gonna give you another example. A lot of people do not understand what poly is. Polyamorous relationships. I have a very great and amazing couple that are poly. They are very alert, very aware. They are conscious about what each other's wanting. They have talked this out. They have planned this. They have everything that they've done is on a positive, healthy way of their relationship. And if they bring someone in that is going to taint or destroy, or even look like it's going to be in a negative light of what they're building as their marriage and their relationship, you must go. And I think that is healthy. So, and they make sure they're healthy, the person that they're bringing in, because sometimes you can be poly and never be sexual. I know people go, nah, that ain't true. It is true. I've got another friend who is she is the person that they bring in, and she's never had sex with the couple, but she's been poly with them for years. It's all about how you and your partner want to design that. But here's the catch. If you are poly, or you think you're poly, and you're the only one benefiting from two partners, you're not poly. Okay? And I know you might say, well, that's another version of poly. No, not exactly. Not exactly. Especially if the other person is not geared to want to be with that person. You say, I want to be with that person. So you're bringing them into our relationship. Now, are you bringing them in as a healthy person? Have you checked? Have you all been to the doctor? All 3, 4, 5, however many people you bring in that you're trying to get with, you should know their status. You should know if they're healthy or not. And I'm going to tell you something. You can tell if a person is up on their healthiness based on the conversations. Oh, you don't have conversations with the people that you're dealing with, then let me tell you this. If you're not having conversations, then your relationship is not strong. You are in a whole different kind of relationship. It might not be, it's a situationship. It's a fuckership. There you go. It's not a relationship. And then again, it won't be healthy. So we must understand what our sexual behaviors are. I understand. Me personally, have a very high sexual appetite, but it's for one person. I'm not a two person kind of. I'm not gonna be poly. I want one woman. That is me. Everybody's not like that. Some people want more than one, and they can find those people, right, that want to be in that type of relationship, but be healthy about it. Okay, let's not be risky with it. And then again, going to understand, and again, that is a stigma. The stigma of what that I choose to want to love a woman is one stigma that as in Black community is still in 2024 still having an issue with. I do not understand. Number two is the fact of my presentation, masculine presentation. Apparently it rubs the man. I do not want to be a man. I love my masculine male energy. There's a difference. I am not trying to be a man. And many of you all out there that are masculine presenting, you are not trying to be a man. Majority of us are not trying to be a man. But we are going to embrace and be truthful about our masculine energy. So that's something that we have to start teaching others, that we're not trying to be a man. We have masculine energy. Just like those men who are saying we want to be men, they have feminine energy. Do you have a lot of it, or do you have a little bit? Which one do you play on? Are you two-spirited? You balance in both. It's all on you and how you want to walk in your truth. But understand that because society has put that stigma on us, on our sexual orientation and how we're viewed, and on our presentation, it does lead to us being, hey, let me conquer. I'm out here and fuck them all. Let me get, hey, who I'm doing tonight. Let me get this one. Let me get that one. Sometimes there are people out there that is all about the conquering. And that's your risky sexual behaviors, because you got to remember who you fucking has fucked somebody else and who they done fucked. And then on and on. Baby, we need to have conversation first. And I think that's where that is a part that is a responsibility of us as masculine presenting women. Stop doing the risky sexual behavior. Start looking at having conversations. Everybody stop being a hoe. I know these streets, I'm single. These streets be calling you to be a fuck boy. I get it. I understand. I get it. I do. It be called every day. I'd be like, nope, no. Because they be called, the street be calling me to me. All right, Cupid, we want you to be a fuck boy. No. I am here for one woman. And so if you're going to be out there, hey, if you're going to be a fuck boy, be a healthy fuck boy. And that's your responsibility, not the person. It is the other person's too. But if they're not looking out for that, if they're not looking out for themselves or you need to do it. And that's something I tell my son. I've always told my son, always, you can have confidence and trust in your ability to be sexually safe. Don't rely on somebody else to have your back and have your sexual health as a priority, because you'll fall short, baby. You'll fall short because they will disappoint you, because you are not. Yes, they might like you. They might think you cute. They might even love you. You still have to be the responsible one for your sexual behavior and your sexual health. Just putting it out there. So let's look at some things. All right. So we have amongst the study that we're going by, that we're reading from, is also that they found significant disparities in healthcare access and use. I can't talk today. Good Lord. Healthcare access among African American masculine presenting gay females. Participants reported experiencing, of course, discrimination because we're masculine looking. You have these, you shun on us, don't give us proper care. But then again, we're learning that healthcare is not always looking at Black women. And because we look so masculine, they forget we Black women. And sometimes we forget. So we have to remember, when it comes to healthcare, you are a Black woman. Number one. All right. And then it's lack of understanding the healthcare from the healthcare provider. Let me talk about that. That goes back to the scenario or the story that I told you during my little story time about my experience, is that they lack of understanding about us. They do not they do not understand, excuse me, they do not understand that they don't talk to us enough to understand that we have insecurities. I'm going to give you another example. And this is because if those of you who know me, I am terrified of the dentist. Yes, I am super duper terrified. I go to one dentist now, and I had to scoot him out, right? It's a black man, Dr. Washington. I love him. He moved from some places, so I got, I'd be fine. I'd be hunting him down. But where he was, I went because I have a crown that he put in and it came out. So I made an appointment, did not know he wasn't there anymore. I got this other guy, Dr. Patel. He came in and he looked at, I told him, the nurses knew this, but it was a new nurse. Don't know her name, but she came and she was talking to me, and I said, look, I need you to understand, since the doctor that put it in is not here anymore, I need you to let the dentist know I am terrified of dentists. I have a high anxiety. I have anxiety attacks. And I'm talking serious anxiety attacks. You hear me? Serious. And this guy, he walked in, he said, open your mouth. And I was like, you understand, I am deathly afraid of the dentist. He says, I really need you to grow up and get over it. I want y'all to understand, I have never moved so quickly out of a chair in my life. I got up. I said, I'm good. He was like, ma'am, you are an adult. No, I have an anxiety that you're not even willing to address. That's what we're talking about when we say stuff like lack of understanding from your healthcare provider. Your healthcare provider, when you first are looking for them, they should sit down with you and talk with you first before you dig in all of the stuff. I understand I'm here for a pap smear, but you ain't ever met me before. You don't know. And the first thing out your mouth would be like, hi, how are you? Do you have anxiety about being here? What can I do to make sure that I can lower the anxiety? Because here's the thing, when you check my blood pressure and I have anxiety, guess what my blood pressure just did? It went out the roof. Now you think I got high blood pressure. And because nowadays doctors just want to throw shit on you, let me give you a script for that. No, you're not going to give me no damn prescriptions for some stuff because I'm trying to let you know I have anxiety. And let me be real with you all. A lot of us, masculine presenting, don't know that we have anxiety. We have not identified it as an anxiety attack, or that we have high anxiety in a situation. We don't know a lot. And I know a lot of y'all are going, oh, come on, Q. Everybody know. No, guys, they don't know that sometimes what they go through is anxiety, right? They don't have a clue. So now you don't know something that's happening to you that they're triggering, and therefore you don't know how to solve it. So I'm going to tell you something. One of the things that I'm going to give you all is partner. Not just your partner as in your girlfriend, but your home girl. Like if you got to, I'm gonna tell you, if you're in a frat, if you're in a fraternity for studs, go ask one of your bros. Say, look, bro, close bro that you ace one, could be your LB, could be your dean, could be your ADI, whatever. You need to have, if you feel that you need that kind of support, that's the whole purpose of why you got a bro. Okay, if you got a friend that you've been friends with since y'all was little, hey, partner, I gotta go do this. Will you go with me? Okay, take that. I'm saying that because it is highly important to be healthy. It is very important. Excuse me, guys. I'm being summoned. Need to correct it, but nevertheless, we're gonna keep going no matter what. Will eventually drop. So as we look at things, we're looking at that healthcare disparity. That is the number one thing that's happening. Okay? The second thing we're going to look at, and it's, let me say this, it becomes us having that problem with our healthcare. It is also one of the things that is the barrier. It's contributing to the barrier of the low rate of STD testing and treatment. I'm going to say that again. Because of your anxiety, because of the lack of understanding that you get from your healthcare provider, it's contributing to the fact that we have low rates of STD testing and treatment. Doesn't mean that it ain't out that, oh, it ain't out there. Oh, it's out there. It's out there in big form, guys. It's out there in huge numbers. But that's because you don't feel comfortable going to the healthcare provider. So you don't go get tested. So a lot of times it's too late. It done something. It was, it was tiny issue. You could take care of a little cream, some pills. Now we got full blown some other stuff happening, right? So let's talk about the high rates of STD. The data indicates a disproportionately high rate of STDs among masculine presenting Black gay females. All right. We've talked about the different stigmas. We've talked about what that, and that still, those high numbers are out there because we won't go get tested. So imagine if we all went and got tested, the numbers that we think are out there, we can confirm, we can treat, and then we can start educating and we can start lowering them, right? So I'm going to be honest with you. If you don't go get tested, please take a heed to what I'm saying. All right. I think you should suck it up, take somebody with you, and let them know that you have anxiety. Let them know I'm not comfortable, but I'm here. Okay. I don't know. I need to do this, but I don't know. I'm doing it by myself, or I brought a friend. I don't know. Say that when you go and when you go to sign in, let them people know that you are uncomfortable. You are stepping out of your comfort zone in their office because you're paying them to make sure you stay healthy. Get your money's worth. If it's in your insurance or not. I'm telling you, my dad, my dad goes all the time to the doctor. He retired this year. And now that my dad has entered the senior age that he is very adamant about making sure he stays healthy. Very sure. So he goes all the time. I promise you, I would say that if he bumped his toe, he's at the doctor's urgent care in 20 minutes. I hate to say that. It could be true. But that man is serious about his health care. And he's serious about the fact that he has insurance to get it. If you don't have insurance with your job, and I'm going to tell you, I used to not care about insurance when I was young. I just wanted the job. Just give me my paycheck. All that benefit shit didn't mean nothing to me. That 401k, all that didn't mean nothing to me until I hit 30. And until my son walked into my life, which is when I hit 30. When Alexander walked into my life, and then I had to realize that I had to be responsible for not just myself, but an innocent human being hey, he has to be here, right? That's how you gotta look at your children. They are blessings from God. Right? So I was blessed to adopt Alexander, and having him in my life made me do what? I asked more questions about what are my benefits. Whatever my pay is, I'm gonna work with you. I got that. But what your benefits look like? I had to have that kind of conversation. I had to start looking at it because in my 20s, I didn't give a shit. I didn't care. I wasn't going to no doctor. I'm good. I'm healthy. Woo! I'm out here having a blast. I hit 30. I was like, what them benefits look like? What the health care look like? What we're doing? So that if you don't have it through your job and your job offers it, the next time they open the door, you need to jump on it and sign up. So let's talk about some things. Let's keep talking. So insurance, is that stopping you from going? It can. It can, because if you got to come out your pocket for some stuff for health, you gonna be like, I'm gonna go to the CVS, holler at them, tell them, look, my eye doing this, my nose, and they're gonna say, go take this. I got something on aisle 14. Go take it. Blah blah. You good, right? That's not what we're doing now. You can't do that with STDs. You can't do that with cervical cancer. You can't do that with breast cancer. That is not how this works. Okay, so we got to look at those things. Is that, and I will tell you, the stigma that identifies us, that has been put on us in terms of how we present. Let's talk about that real quick, because you all know if you have not seen it, go to our YouTube, Real Boys Talk, and there's a 2-part on image. It's very important to understand that your image, and I will say this, and because you all know I'm in the Greek, Greek community, I am a founder. I can honestly say that by there being some very positive fraternities out there, the image of masculine presenting gay females has changed. I've been in this game for 16 years. My org is 16 years old. And when we started Sigma Omega Phi, the image of Black studs was a hot mess. Okay. It has grown and has evolved and has gotten better because now representation, when you don't see yourself out there in a certain particular industry or a particular environment or a particular conference or conversation, then that means you need to be that representation. Okay. And a lot of times, and I will say this, there's a lot of founders that are founders of fraternities for masculine presenting that understood that and have presented and have been representations of us in a very positive, professional, and changed the narrative, opened the door. And sometimes they said, you ain't got to give me no chair. I'll come with my own chair and sit at the table, because that's it. That's the thing, is that we are not at a lot of these different tables, but we're not even being discussed. The thing that you got to understand is that Black lesbians are being discussed. There is a itty bitty difference with the things that they're discussing and how they're presented in community. When you put masculine presenting gay Black females together, and then you look at the Black lesbian, there are some things that need to be different when it's coming to us, when it's being articulated to us, when it's being in conversations to us. When we're having conversations about things, you got to present it differently than you do to Black lesbians or non-conforming or non-binary. You understand? You see where I'm going? All right. So the stigma, this is what they're saying. The stigma was identified as a critical factor impacting sexual health. That is true. Because some of us, not them, but some of us will look in the mirror and think we need to do manly actions. We need to have a manly persona, not a masculine persona, but a manly. There's difference, guys. And that's something we can talk about if y'all want to. So there's a difference. Excuse me. Gotta make sure I'm hydrated, as the ladies say. So what you're looking at is that stigma on us does definitely impact our sexual health. We out here fucking everything that's moving. I'm gonna give you an example. I also do Studs and Films Lavender Diaries. Many of you follow us. Many of you all have watched it. Many of you all have participated in the audience, asking questions when we've done live in Atlanta last year. We were in Houston, we were in New Orleans, and we're back in Atlanta this year at the LGBT Greek weekend. So definitely check us out. We're talking about dating. Anyway, we've had those. When it comes to sexual health, a lot of times we, as masculine presenting, go and start dating what you can say are straight women, bi-curious or moment curious. Let's put it that way. A lot of times we go and we dealing with these straight women. Now, right there, when I said that, I know what I thought. I don't know what y'all thought, but I hope that we were thinking the same. So when I said studs are going to get with straight women, that means you're getting with a woman who is normally penetrated by a man. Okay, with a born attached penis, if you don't understand what I'm saying. And that is where you now are going to be. You're with that woman. Do you know her sexual history? Do you think she could just be promiscuous today? You might just be promiscuous today. That's what's happening with our sexual health. We're not being healthy about it. And I'm going to tell you why. We're out here, we just willy-nilly. Instant gratification is the U.S. is now, if you ask me, that is the motto of the American, is instant gratification. I want that right now. I want to feel good right now. I want to do this right now. I don't want to wait. I don't want to get to know you. What's one of the songs? I knew her pussy before I knew her name. Come on, guys. We got to do better. We got to do better. You just can't. I mean, if you out here and you hitting and you smashing and grabbing things like that, I ain't knocking. Let's do it healthy, and we're not. It's obvious that we're not, and I'm gonna tell you why it's obvious. You know what's obvious? Because I'm having this conversation. Because I'm putting this podcast out here. Because this is a subject matter that I'm having to address. Because I've looked at a research that is several pages long. So apparently we ain't doing it right. Okay, so let's look at that. The participants in this particular focus group described how stigma led to secrecy about their sexual orientation and behaviors, resulting in delayed and avoiding health care. That meant that you were fucking around, didn't want nobody to know you was fucking around with women. If you were like, maybe you were tomboy all your life and you ain't really out. So you sleeping around with all these different women, or you out here in the streets at the club, going into the bathroom, doing what you do. And that's not healthy no more. Let me just say that. Come on, guys. It might have been healthy back in the day. I'm an older person. So at one point, maybe wasn't healthy then either. But we wasn't paying attention. That was not on our radar. But guess what? Today it's on the radar. Okay. I'm letting you know it's on the radar. And you gotta step out of the pleasure appetite. That's what I'm gonna use. The pleasure appetite. And start looking at how I might get pleasure today from one individual, but what I'm gonna do about tomorrow? What I'm gonna do about next week? I don't even know this girl. I ain't got a phone number, nothing. You know what I'm saying? We looked at each other. She was like, shit, you want this? I was like, yeah, sure, whatever. That's what we should not be doing. Because what's tomorrow bringing you? You by yourself. Now you got to go find another, as the streets say, victim. Hate to say it like that, but that's kind of what it is. And then there's the angry person, the person that has been caught and got sick, is sick, caught something from somebody else and they don't know which one, but they know they caught something from somebody because they didn't ask enough questions. So now they're bitter. So now they want to give it to everybody. That's not how this works, guys. We can't do that. We got to understand that life is precious, all life. Even the person who did you wrong. You got to go. That's a level of therapy, level of learning how to heal properly. Okay. And it's also, you can prevent. The word prevention is what you need, what we all need to be working with. Femmes and studs, we got to start being preventive. Ask those questions. When you're on your day, ask. Say, have you ever had an STD? If they look at you wrong, man, come on. If I'm trying to date you, get to know you, I'm going to ask. I need to know what your sexual behaviors are. How many times you had like a one-nighter? I ain't saying we all have had one-nighters, but be honest about that. I don't want to know your body count, but if your body count is over 1,000 in 6 months, we got a problem. You fucking the shit out of somebody. You is out there, honey. I hope you're getting paid. Is how I'm looking at it, because you's all for real. Now let's keep going. It's resulting in additionally, internalized stigma and social pressures influence our sexual health practices and communicating with our partners. That is what I was just saying. We internalize certain things and we go, oh no, I'm gonna be that hard nigga. You know what I'm saying? I'm that stud. And I'm gonna break my chest out. And no, I ain't gotta talk to you about I ain't gonna talk to you about what I do. And then the understanding that society, we pick these roles. And yes, everybody is not about the roles. I get it. But some of us are. And so we pick those more masculine or manly roles to walk in, which says, one, we have to be hard. We have to be the provider. We have to be all these different things. So now we don't have that opportunity to communicate with our partner to make sure that we're having healthy sex practices. And let me give you one. It's a number one sex health practice that I know many studs do not do. And I know y'all ready to hear what it is. It's called the strap. Let's talk about that. A lot of studs do not know how to clean it. A lot of studs do not know how to protect their partner when they're using it. So I'm going to help you. If you know, and that's wonderful. Thank you. Spread the word. Teach others. Teach one. Teach one. Teach one. One will teach someone else. That is our motto. So here's the thing. With your strap, if you are now, let me go ahead and say this. If you buying a $39.99 strap, stop it. If you're not spending money, and I'm not trying to be funny when I say this, if you ain't spending over $150 on your strap, and you might get one on sale, but the value of it was over $150. If you're not really investing true good money into your strap, stop it. Stop it. Invest some money. Let me tell you why you can invest money. Because then women are going to continue to ask you to buy a new one. Because they're going to know that you understand how to protect yourself, how to protect them, and how to clean it. Now, when you get your strap, please use a condom. Oh, Q, why we got to use a condom? I ain't got no sperm. Cause. Let me explain to you. That strap, that penis that you bought is made of plastic. It has pores. A woman's pH balance today, actually, the moment that you're having sex with her and you're using that particular dick and you don't have a condom on it, that dick is absorbing her pH and her juices into its pores of that plastic. And promise you, an hour and a half later, that woman's pH balance has changed. So if you fuck her again with that same strap, and the same strap, even though you might have washed it, cleaned it, whatever, it still has her pH balance before. It has changed now. Now you will mess up. It's all her. It will still mess up her pH balance. That's one. Two, if you use it on, let's say you use it on Samantha. You fucking Samantha today. You didn't use no condom or nothing. You go, but Q, I cleaned it. Don't matter, partner. It's got pores. It's plastic. It's made out of silicone substance. It breathes. Technically, if you want to say it like that, it has pores. It has sucked up hers. Now you go be with Sabrina a week later. You still have Samantha's pores in there. So now you see where I'm going? Now you messing people up. Use a condom. Period. And you do it on, I don't care if you're doing it with the same woman, that's your wife, you've been with her for 100 years. Use a condom. Because her pH balance changes. You are a woman, you need to understand that. If you are being strapped, like your woman straps up and does you, make sure she got a condom on. You have a pH balance too. You ain't no different. You are a female. I don't care how masculine you are. You still are a woman at the end of the day. Whether you want to embrace your femininity or not. I'm sure I got some femininity in me. I'm sure there's some subject matters and some situations and where I will be all femme. You hear me? Let there be, I'm not on the creepy crawly thing. So if there's a snake in the house, I ain't getting it. That masculinity left because I will put on a dress. Well, look, we both women. But no matter what, you must protect you and your partner. Now, cleaning. I have found that people will clean the dick and not the strap. I personally, on my strap, I use alcohol rubs, the little pads, and I clean it very well. I take it apart, do the whole nine. Do the same thing. I do wash. I do it. There's a, I can't think of the name of the cleanser stuff, and I don't have any right now, but I'm single. I'm not doing anything with anybody, but, not to worry, because it's clean. It's packed up and clean. But there is it's a facial cleanser. And it's in a white container with blue and green on it. Very good for your face, but it's really good. It's mild. So it's really good. You can use it and doesn't break your dick down. Because some cleansers will literally break that silicone, what it's made out of, and it'll start tearing up. But and if you don't know, I believe there is a cleaner. If you go to some of the sex shops, I believe there is a cleaner that you can get for the actual dick itself, not just the harness. But clean your heart. You can clean your harness with, an alcohol pad to clean it, disinfect it. And don't just do the outside, do the whole thing. I do the straps, I do the whole thing. Because either way, I just want to be safe, right? That is part of what we're seeing. Okay. And that will also eliminate, let me say this, that will, if you're having a conversation with someone about their sexual habits, how often do they go to the doctor? How often do they, how often have they ever had an STD? If they say no, then, you got to trust people, but you also have to go, hey, maybe you and your girl, y'all getting together, y'all about to, do the thing, and y'all say, hey, look, we're about to commit to each other, so I'm going to commit to you, and guess what? Let's go together to get tested. You can do that too. I look at things and I go, you have to decide how you want to have your sexual behavior, how you want to do it. Long as it's healthy, that is my motto. Just make sure it's healthy, right? So again, that's what happens when we say that the internalized stigma and the social pressures influence our sexual health practices and communication with our partner, right? Part of that is because we don't protect ourselves when we use the strap. We don't put a condom on it. We don't think that it can harm anybody. It's just, yeah, I'm putting it on and keep it going, blah, 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 blah. Then I'm take it off, put it on next girl, blah, blah, blah. It's not like that. It's much more. You got to be, conscious. It's like if you had a dick, you just gonna keep it, you ain't gonna wash it. Like, think about it. That's how you got to think about the strap. That's how you think about it. And I'm gonna give you another one. Some women are so sensitive, and you got to know this about your partner. What I'm about to say, so sensitive that you cannot go down on them when you have a canker sore in your mouth. You have anything open. Like, I've bitten my jaw. Innocent thing. I was eating, being greedy, and I bit my jaw. I'm not having, I will wash my mouth out with, peroxide, and then I'll, make sure it's clean and all that kind of stuff. You have to have a clean mouth, guys. I'm gonna tell you, if you got gingivitis, any of those things, don't go fucking with your woman. Wait till you get those things under control, because you can give her something. You can mess her pH balance up. I'm just letting you know. And these are tiny, tiny things. We ain't even in the STD thing, right? And if you got something and you go get treated, be mindful of and listen very clearly to the instructions of what it's going to take for you to get rid of it. If you get HIV, be mindful. Get all the knowledge that you can. And let's say, what I prefer to say is that you don't. Be preventive before those things even happen, before you even lay down and start knowing the person. And I'm going to tell you why I say it like this. Because if you create intimacy with someone you want to be with, you're trying to build a healthy relationship with, you're not just a snatch and grab. We're not just a one-night stander. I ain't just your friends with benefits. I'm not just fucking you and moving on, and that's it. And if you are friends with benefits, then y'all know each other. And so you know each other's habits. But if you are not paying attention to how your body is flowing and how their body flows, you can mess yourself up. And then you also, if you get something, don't go out here being an ass and say, fuck, if I got him, give it to everybody else. Fuck this shit. You know what I'm saying? Because I ain't the one. You know what I'm saying? I'm Big Dick Willie or Wilhelmina. Don't do nobody like that. Don't do people like that. You're knocking your blessings. So now that we know these things, but guess what? We still don't have numbers to go with these things. We know why we don't have the numbers. That's a hardening. That's the sad piece that's the piece that I hate to say to y'all. We don't know the numbers. You know why? Because of all of what I've been talking about. All the stuff I've been talking about, which is what? So simple to correct. It is. Make sure you got insurance. You ain't got insurance with your job, go to the what is it? Obamacare, affordable health care. I have it because I'm with AmeriCorps. I'm doing nonprofit stuff all the time. And because of me being a part of AmeriCorps and I'm teaching, they don't offer us insurance. So I went to the marketplace, got me some insurance. It's actually not bad at all. Actually, as a matter of fact, it's not bad at all. So get you some insurance if you ain't already got it. And let me say this to my older crew. Just because you over 50 don't mean you can't get some shit. We got some irresponsible 50-year-olds out here, guys. We got some irresponsible. It ain't all on the, because everybody think it's the young guys. Everybody think it's them youngsters, 20 to like 35. No. A lot of this is going to come from our older crew, the 45 to 65. They fucking around too. So some of these studs, and I'm not putting it all on the studs. Let me not put it all on the studs, but that was our conversation, is studs and STD. These are the reasons why we don't have the numbers. So my challenge to everybody is hey, even if if you have home, let's just say you a house and you got studs in your house. And now what I mean by house is those that know families. Like I'm in a family. When I was doing back in the day, when I was, being a drag king and stuff like that, I was in a family. Or I had friends, studs that were my friends. Hey guys, let's go get tested. It might seem stupid. They might be like, what the fuck? Or ask them, hey, dude, have you been tested? Have you gone to the doctor? You need me to go with you. It's not like, I'm going to let y'all know something. It's not like voting. Seriously. You don't go to a doctor to make sure that your body is healthy. Your mind can never be healthy. Your heart will never be healthy. Your spirituality cannot prevail if your body is not healthy. If you think or you feel like, hey, I'm gonna be out in these streets, and I'm being dead ass serious. If you are going to be out in these streets doing what you do, whatever it is, being a playboy, being a fuckboy, whatever it is, I ain't knocking. Do you? If that's your role, that's what you want to do, you jumping from female to female because you're just a conqueror. Be the best healthy conqueror you can be. I'm not knocking you, dog. Do you? But be healthy about it. So the conclusion of their thing was that the challenge that we are faced with is accessing healthcare and maintaining sexual health. So from this, Real Boys Talk is going to do a lot more discussions about sexual health and us, masculine. So you're going to see a lot more of these, and I'm going to try to pull in some professionals that can have conversations with us as well. All right. So I want you to understand that we contribute to the high rates of STD. It's known that we will, but we need everybody to go get tested. We need to have that test. I don't mind going, hey, I'm clean, I don't have nothing. Because I injured, those who know, I injured my knee during our spring event. I re-injured it. It was injured many, many years ago. But I often re-injure it, just exercise and doing stuff. And by me having to go to the doctor, I had them do a whole test thing, do the whole panel. They did the pregnancy test too. I thought that was kind of funny myself, but the lady was like, well, I'm going to do it anyway, just in case. I looked at her and said, ma'am, look at this. And then she said, we just had 3 masculine presenting ladies in here who are pregnant. So no, I'm going to go ahead and test you anyway. I said, oh, you're so cute. And I didn't get upset about it because, hey, that's part of healthiness. So they did the whole panel. I ain't got nothing. Ain't got no high blood pressure. Ain't got nothing. That is what you want to hear. But you can't hear that. You can't hear it if you don't go. You got to go. Guys, you got to go. And I am one. And for me to say that, that's saying something because I have anxiety going to the doctor. And right now, I'm having issues with my shoulder and my knee. I'm at the doctor's for the next 3 weeks. Once a week, I have a different doctor I got to go to. Because I am adamant about, I want to find out what it is. I don't want you to just tell me, well, let me give you this shot. No. That shot is temporary. I want to know what it is why it's happening, and how we going to get rid of it. And don't give me no pain pills just to get me through the pain. Let's eliminate what is causing it. And that's the thing that doctors, you gotta know. You gotta say that to them. I want to know what it is, what my options are to get rid of it. How long is it gonna take, and what are the side effects, or what damage have I already caused because I waited? Some of y'all don't realize you go blind. You can lose your eyesight. You can use, as corny as this may sound, you can lose your life fucking around with an STD because you thought it was, oh, I don't know, I thought this was okay. I saw this TikTok, and they were non-African American, talking about how she don't care that she got a yeast infection. Are you kidding me, ma'am? Ma'am, you is making dinner rolls. She was like, oh, I don't have to buy yeast. This is the most disgusting thing I had ever heard. But if people think that it's okay to have a yeast infection is little, but it can become a major, I believe, if I'm correct, and if I'm not correct, please someone comment. I believe if you let a yeast infection go long, it becomes chlamydia. Let me explain to you. North Georgia, and this is on not a gay, this is not part of LGBT, this is just North Georgia, has the highest rate of chlamydia in the U.S. Now, we number one? I don't think so, but we up there. And that's a note in itself. It's like Atlanta. Black women, HIV, high, real high. So while some of y'all running around here trying to get these little straight women, stop it. Ask some questions before you start getting in. How many, you ask them about that. Look, I am very much not wanting to know. I don't want to know your body count. And I don't want to tell you mine. I don't want to care about that. What I want to care about is, are you healthy? Were you healthy with all them body counts? Were you healthy with one body count? If you say, oh, I ain't got but 2 body counts. Okay. Were you healthy? Did you practice safe sex? What did you do? What did you not do? Have you ever, some people have never even heard of Denodam. There's a female condom out there. Get you some. Prides. I promise you, if you have a Pride in your city, there's some female contraceptives there. You can pick you up some for free. They got it. I know if you want to Atlanta, I know Atlanta Pride in October. Come see us. They're gonna be there. I promise you. So in all of this, what I'm basically telling y'all is the research doesn't give us numbers. What the research did was give us why we don't have numbers. Now, from everything that you've heard, the question is, what cue do we do now? I'm going to tell you. We got to give them the numbers. How do we give them the numbers? Get tested. Test for everything. If you have insurance, use it. When you go to get your annual, say, hey, I need y'all to test me for everything. Get a new partner. Go get tested so you can make sure, secure that woman's mind that you are safe. That's a sign of caring. That's a sign to let her know that, hey, I'm looking out for you as much as I'm looking out for myself. Wrap that strap up with a condom. Clean it and put a condom on it. Safe sex. You ain't getting nobody pregnant, but what you are going to give somebody is a yeast infection, possibly chlamydia, anything, because it has pores and it can devastate a woman's pH, especially if, like I said, if you talk to the woman and you know her. A lot of these women are sensitive to everything. It's like you can't even have a cold and go down there. I ain't saying you sneeze or cough in the coochie or nothing like that, but if you have a cold, you could give her that cold. I know that sounds weird, but you can. So you got to make sure, like, if you got, like I said, I bit my jaw. I was single, but I bit my jaw, but you got to think about that. I would not want to, if I know that my partner is sensitive to anything, I'm going to be very clear to make sure I'm healed, make sure my mouth is clean, right? Excuse me. So in essence to all of this, resources, I'm going to tell you, your resources is if you're in fraternities, have conversations. If you have a partner, have a conversation with her. If you don't know anything else, go find you a GYN. Test out several of them if you need to. You ain't got to do nothing but say, look, I'm trying to make sure that we're not doing any testing. I'm consulting because I need to know if you're really going to be right for me. You have that right to do that. You don't have to just go to Dr. Bob. You don't have to go to Dr. Mary. You can go to both of them to see which one is going to make you comfortable. Because if you're comfortable with your physician, you're going to share. That means that physician will know you. That physician will understand. That physician will be looking out for certain things because you've told them what you're doing. All I want y'all to do is be healthy and safe out there. That's really what this is. So my studs, my masculine presenting, I challenge you. Go get tested. Know that you're healthy. Know that you're clear. Even if you're a fuck boy, know that you're clear. Know that. Don't just go, I know I ain't got nothing. Do you? Do you really? Don't play with nobody's health. Don't even play with your own. It's too much. Life one is too short. And you shorten it because you're not being healthy. This is the only body you're going to get. Only body. You got to take care of it. You have to. How you gonna be looking masculine with your titty falling on the ground because you got breast cancer? How you gonna be looking masculine when you got an STD? How you can't be sexy? Ain't no sexy when you got an STD. Ain't nothing like that. And why put yourself in that kind of situation when we can have preventive sexual health? You can be preventive. And I'm not saying you gotta be one person. You're gonna be with a bunch of people. Do it healthy. Do it right. Talk. Communicate. Don't just fuck. Talk before you do all of that. Just so you know what you're working with. Just so you know what you're getting yourself in. Because some people won't say nothing. If you don't ask, they won't tell. But if you start talking, I'm gonna tell you something. If you start asking a woman questions about her sexual behavior and her sexual health, guess what happens? She's either gonna be very much like, oh baby, this and I did and I ain't and this, or she's gonna become very uncomfortable. And that's a sign. A lady told my boss said this. I'm going to give her much credit for this. My boss said this: pink flags become red flags. So let's eliminate the pink flag before it becomes a red flag. Think about that. I leave you with that today. Again, what can we do? We can take this conversation, have it with some films, have the same conversation with your folks, have the same conversation within your fraternities. I challenge each fraternity that's out there for masculine presenting. How about y'all have this conversation? How about y'all talk about studs and STD? How about you talk about your sexual behaviors? How about you talk about your sexual habits? How about you talk about sexual health? I'm going to talk to y'all again about it. We're going to keep talking about this until we get it where ain't not one person on the got an STD in the LGBT or in the masculine presenting environment, in the black lesbian environment. I'm going to keep talking to y'all about this over and over and over. And y'all be like, damn, Cupid. But somebody needs to hear it. It's important. I want everyone to live positive and healthy, blessed lives. And you can't be masculine if you're unhealthy. I'm just letting you know. It's hard when you can be preventive. So let's be preventive. Let's have a wonderful rest of our day, guys. I love y'all all. And again, this is Real Boys Talk health series about studs and STDs. So what's coming up? Let me tell you. The biggest thing that's coming up is Labor Day weekend in Atlanta, Georgia, the LGBT Greek weekend. If you are Greek, want to see you out there, guys. We are out Friday. We have Empowering My Sisters, which is a lunch and learn. We have some amazing panels that are going to be on that. They're going to talk. These are women. Some are studs, some are femmes, some are our allies, and they're coming together. We have a panel, and we have you in the audience. We're going to serve you some lunch, and we're going to have some conversations about how we can be better, how we can be healthier, how we can have good relationships, positive, healthy relationships, whether it's in your career, whether it's with your family, whether it's with a lover, all of that. And we're going to talk some politics. We're going to talk a little politics. All right. Then also that evening we have open house, which is a Greek showcase. We got 2 probates happening. We got a fashion show going on, and we got Greeks Walk the Runway. You want to be there to see it. If you are interested in any type of fraternity or sorority, whether you are a masculine or you are a femme or you are bisexual or you are non-binary or you are a man or you're a transgender male or female, those fraternities and sororities will be in the house that night. You might want to be there so you can get your first introduction to what this is, what this environment is, what the Greek lifestyle is all about. This is just a small smidgen of it, but guess what? We also do community service. We are in the community, right? On Saturday, we have our annual brunch, which is for the Greeks only. Amazing thing. I can't wait to see y'all out there. I love to see. I know I'm going to be seeing a lot of new faces, so I'm excited about that. Also, that evening, Kappa Xi Omega Sorority Incorporated is celebrating 20 years. That's their anniversary, and it's their gala. And then on Sunday, if you want to do the park, Piedmont Park, of course, there's Pure Heat that's always there. But we also have Party with the Purpose by OE Pi Sorority, which is Omicron Epsilon Pi Sorority. They do their annual Party with a Purpose, and it is at my sister's room. It is a day party. It is also a white party. Yes, I bought my white. I can't wait to show up sexy in the white, baby. So I got mine. You get yours. Meet me there. It's from 3 to 7 at my sister's room. Then we have a pool party, a luau pool party that's happening. Another sorority is sponsoring it as well. Please check it out. If you want to know all the details, it is going to be on the website of lgbtgreekweekend.com. You can definitely see everything that we're doing, what we're having that weekend. If you are a fraternity or sorority and you have not signed up, you might want to. I think by now, everything is actually sold out across the board. We have Lavender's Diaries that will be there Saturday. And all of this Friday and Saturday events are at Georgia State Student Union, 55 Glimmer. That's what it is. Glimmer Street. Excuse me. Glimmer Street. And again, all of this details is on the website, but we will be there for Friday and Saturday. And Studs and Film Lavender Diaries will be at 2:30, same place, Student Center. And we will be talking about dating. I want y'all to know it's shitty out here. Real shitty. But we're going to have that conversation as well. So you want to be there. We got an amazing panel. We got a lot of our cast are going to be there. All our cast will be there. So you definitely want to check it out. And come be in the audience. Ask some questions. Tell us your stories. Tell us what you're finding out about dating. Because on my end, I'm telling you now, it's shitty. Shitty as hell. So definitely, hey, check us out. We want to see you there. Real Boys Talk. The next one that we're doing is called Shooting the Shit with the Brothers of Sigma Omega Phi Fraternity Incorporated. I am also hosting that, and it is about Project 2025. We're going to start taking and breaking it down because I think our community, I don't think y'all listening. And we're about to be in some trouble if you're not. So definitely want to make sure that you check us out. That'll be next Friday's conversation. Is Shooting the Shit. We're going to talk about Project 25. We're going to break it. It's a series. So we're breaking up 2 subjects at a time so that we can get you through, because that's 950 pages. If somebody takes the time to build something that's 950 pages, I don't think we should ignore it. And so we're not. We're going to help you get through it. We're going to help you understand what it is and how important this is. I know we say it all the time. This election is important. This election is on fire. You hear me? So that also on Friday, hey, at 8:00, once you finish listening to this, or you can do both if you want to, we are doing the mass presenting for Harris. Yes, we got some amazing people who are going to talk to us. We're going to talk about voting. We're going to probably talk about Project 2025 as well. We're going to talk about how it will affect masculine presenting gay females. And this is across the board. This ain't about black or white. This is masculine presenting. So if you are masculine presenting and you Asian or you Hispanic or you white or you're black or you whatever your ethnicity is, you need to be on that too. And that is going to be on, if you go to the Facebook page of Real Boys Talk, we're going to be showing it live there and on YouTube. So either or, you'll be able to get, and you get there, you'll be able to give us some questions. You'll be able to tell us your thoughts. We're going to do all of that, okay? It is going to be amazing. Again, this about stud health, we about to come back on you because there's some stuff that we ain't paying attention to. All right, guys, take care. Be healthy. Keep talking.